Would you mind to like and subscribe to keep it free for others? You too can send your results.
I am a little shy to use my real voice, so that please forgive me to use pre-recorded voice.
The question.
What happens after a high PSA test?
Professional explanations. 4. Ordinary people.
Trustworthy information by medical professionals.
Results interpretation.
Receiving a high prostate-specific antigen, PSA, test result can be concerning, but it's important to understand that elevated PSA levels don't necessarily indicate prostate cancer. Several benign conditions, such as benign prostatic hyperplasia, BPH, or prostatitis, can also cause increased PSA levels. Next steps after a high PSA test. 1. Retest PSA because it's fluctuating due to non-illness reasons. If still elevated, compare your PSA total test level by your age. 0 to 2.5. Normal for a man 40 to 50 years. 2.5 to 3.5. Normal for a man 50 to 60 years. 3.5 to 4.5. Normal for a man 60 to 70 years. 4.5 to 5.5. Normal for a man 70 to 80 years. 2. Your doctor will measure by ultrasound imaging the volume of your prostate. Compare your prostate size with this age-specific sizes. Around age 40, prostate gland begins to grow. 50 to 55 years old, the prostate size is 24 to 25 cc, almost similar to the size of walnut or golf ball. 75 years old, the prostate gland size is about 38 cc. The higher means abnormal size. If you considered your age, then the PSA total, prostate size and weight were higher than normal ranges, thus you must do the next steps. 3. Do MRI to know which is the suspicious areas in the prostate gland has cancer or not. 4. If MRI found cancerous sector, then biopsy is must to microscopically scanned and examined for making sure it's a cancer. 4. Other calculation may be made by your doctor, such as free total PSA ratio and Gleason scores can also help make the prognosis clearer. Your prostate has benign inflammatory BPH, prostatitis, if prostate size less than 60, PSA total less than 10, F, TPSA greater than 19%, Gleason score less than 6. Your prostate has high cancer risk, malignant, if prostate size greater than 80, PSA total greater than 10, F, TPSA less than 9%, Gleason score less than 7. If you weren't know, free PSA is the trace amount, tiny amount, of the PSA, prostate-specific antigen, which not from the cancer cells. Therefore, the increasing in the free PSA percentage is better than the increasing in other forms of PSA, which may represent the cancerous forms. The other PSA forms can't be measured in the laboratory, only the free form of PSA and the total PSA amount that can be. If your PSA is high, it indicates that either forms is high, but the free PSA reading means the level of only the free form. Taking the final medical decision on the ratio of free to total PSA can be more indicative and beneficial when deciding the need of biopsy. Because if the increase in PSA is not from the free percentage, the elevation may be from the cancerous forms.
Bloodtestsresults.com. Happy to help.